Acute pain versus chronic pain. So let's visit about that first. So an acute condition is something that happens relatively quickly, meaning you were maybe lifting up something in the yard over the weekend and you felt sudden low back pain, or you were in bed and you went to get out of bed and you developed sudden neck pain. So acute conditions typically are going to occur within 24 hours, 72 hours. A chronic condition is something that obviously, sadly, many of us are aware of. Those types of conditions are going to last much longer. So a chronic condition is one that could last, 5 to 6 days, even unfortunately to years. But related to this question, that sudden low back pain, let's talk about acute type injuries. What are some things that you can do on your own, for an acute type back injury, shoulder injury, knee injury, whatever the case may be? Number one, and probably the most important, is get it checked out. Many times, sadly, we have an acute type injury. We think it's going to go away. We don't have the time to go to see someone, those types of things. And this acute injury, unfortunately, progresses to a chronic injury. It starts out as one day, and then you wake up 6 months later, and you still have neck, low back, knee pain. Proper diagnosis is very important. And what I mean by that is when you're getting checked out, the physician can develop a proper diagnosis and a proper treatment plan. So, although I mentioned at-home tips, I think that it's really important with an acute type injury that you get it checked out, make sure that you have the appropriate treatment plan. Many times you can manage these types of conditions on your own, but I think it's very, very important to get it checked out properly on the onset and get a proper diagnosis and therefore a treatment plan. So some things that you can do at home. Now, once we've kind of figured out we're dealing with a sprain strain type injury in your back, ice versus heat, which, it's like the question of the ages. I get it all the time from my patients. Which do I do? Think about this. When you have an acute injury, there's typically going to be increased blood flow, which causes increased inflammation. Think about a sprained ankle. Many of you have sprained an ankle before. As that ankle swells, a lot of the toxins and a lot of that nasty stuff builds up into that joint. Unfortunately, the good stuff, the healing agents, can't get into that joint to start doing its job, and you can't get the waste out. So what we want to do is obviously bring the inflammation down. So when you think of an acute back pain, obviously when I put my hand back here, we're not dealing with swelling necessarily. Many times it's very deep within the joints or the muscles. Think about the sprained ankle being swollen. So we want to get some ice on that area initially. I typically will recommend 20 minutes on, 20 minutes off with the ice. Cycle through that as much as you can. Frozen peas, whatever you have in the freezer, you can use. As the swelling starts to decrease and you get into days 2 and 3 and 4, then that's when you can start adding a little bit of heat. And what we'll do with the heat is we'll actually then start to increase the blood flow, get all that good stuff in, get the waste products out, and then you can really speed up the healing process. Ice is an analgesic. It will make you feel a little bit better. Unfortunately, heat does the same thing. That's why many of us, when we're stiff and sore, we reach for that ice or that heating pad. I like heat more for those chronic or those longer type conditions. So let's use ice in these acute episodes. Secondly, pay attention to biomechanics, your posture, the way you're doing things. Do I sit at a desk for extended periods? Yes. Get up and move around. What's my sleep position like? If you are involved in some form of a job that requires a lot of labor, focus on proper bending, proper lifting mechanics, those types of things. It's so important as we start to heal through these acute injuries, we don't give that thing a chance to come back. And that many times, most of us will aggravate that low back with, improper bending or things of that nature. And so that will, you'll have a reoccurrence or an exacerbation of the injury. And then lastly, keep moving. It is so important with these types of injuries, that you don't go home and lay down for extended periods of time. I'm not suggesting that you need to be running. I'm not suggesting that you need to maintain your normal activities or your exercise routine, but it's so important that you do something and keep moving. Years ago, you would go to your physician with acute back pain, and the recommendation would be, go home and take it easy. That is the worst thing for you, in that, things start to stiffen, you start to lose range of motion, and it's all within reason. Don't get me wrong, depending on the situation, depending on the severity of the injury, we might be required to slowly phase into more movement-based activity. But for the most part, the general sprain strains, we really want to, just maintain some form of activity or mobility throughout the day. And that will allow us to maintain mobility. It will keep those joints lubricated and moving. It will also speed up the healing time. So a couple things to review here. When you have an acute injury, one of those sudden type injuries, let's get it checked out. Let's have a physician take a look at us, make a proper recommendation on what we need, what our diagnosis may be. Secondly, ice is the best option. We really didn't get into extremities, but compression, tightness, elevation are really good to slow down that inflammation along with ice. Focus on your biomechanics. Focus on, how you're bending, you're lifting, those types of things. And then fourth, and most importantly, what we always say here at Tulsa Spine and Rehab, keep moving.